Well, interesting choice of film for a discussion on STDs. A few thoughts. First of all, the kids in these horror movies have the absolute worst parents in the world. They're nowhere to be found. They're just useless and clueless and, barely a presence. And there was a lot of interesting filmography. The young lady who had the unfortunate demise early in the movie lived in 1492, of course, the Columbus discovering America and sort of the discovery that's going to come from the film. The oddity of the house numbers, where on one side of the street there are 3 numbers, 872, on the other side there are 5 numbers, all sorts of odd things. Also, I don't know if you noticed the mix of decades in this movie. So the young girl is with her definitely late 1990s, at the earliest, little shell where she's reading books, like a mini Kindle, and yet the televisions are definitely 60s vintage. I'm old enough to have had, my parents had their first black color TV, and it was very much like the one lonely color TV you saw in this movie, and I think we got that in 63 or 64. And then the cars were also mostly 60s, but then you had some 80s, you had some 90s. So the director's fooling around with us. Another thing he's fooling around with us is this whole premise of the curable STD by having sex with somebody else. And of course, the Phantom has figured this out, that it's more fun, presumably, to chase a variety of people. And the poor young lady, I don't know how many days this movie extended towards, over. Yeah, it doesn't seem like too long a time period.
Yeah, it seems...
a week, maybe?
Maybe.
There weren't too many seasons, so I'm wondering maybe a week.
Yeah.
And I counted 6 sexual partners, okay? The original guy who gave it to her, the guy who tried to help her get rid of it, the 3 guys in the boat, which was a really strange editing choice of the editor, because she starts swimming out to the boat, that's the end of it. We don't, we think maybe she's going to get rid of it by sleeping with one or more of these guys in the boat, and then we never hear from the boat again. Did she pass it on and they all died and the creature? That's an editing choice. He made a 2.5-hour movie, the editor cut it, and for reasons that are completely obscure, didn't cut the boat scene.
I don't know. I feel like there is supposed to be that element of
that's right.
of
so maybe
a little bit of
purpose.
Confusion,
right.
Misdirection.
But
obviously,
six sexual partners in a week's time is certainly a good way to get an STD. A good way to give it too. So without pretending to be an amateur filmographer, which I'm certainly not qualified, I will tell you that thinking through what this might mean vis-a-vis an STD theme, we have one conspicuous lethal STD, and that's HIV. The curable bacterial infections like gonorrhea, chlamydia, the parasitic infection, trichomonas, they're all they cause symptoms. You can go to the doctor, you can be treated, you can be cured. The viral STDs, for the most part, are kind of the gift that keeps on giving. HSV, you've got for life. HIV, you've got for life. We don't know how to cure either one. And there is actually a myth that's highly prevalent around the world. I've heard about it in Asia and Africa, which is that if you're a man with HIV, if you have sex with a virgin, it will cure you. And I kept, thinking about this. This is the only analogy I can come up with in this movie to STDs is this idea that if you have sex with somebody, you can get rid of it. And of course, biologically, it makes no sense at all and is completely fraudulent. But I guess if a phantom is coming after you and the phantom is mixed up with this STD thing, and I guess then it makes sense. But
like I said at the beginning, it's a tenuous connection.
That's right, tenuous connection, tenuous connection. But I did want to share with you what I'm supposed to, namely HIV is not a death sentence anymore. We have the antiretroviral therapy, the triple therapy, which can at least suppress the virus, and if properly administered, properly taken, can suppress the virus for life. So we're seeing lifespans of persons with HIV who actually are fortunate to get access to the medicines and adhere to the medicines to actually approach normal lifespans. And that's quite a shock. I was a pediatrician in New York City in the 1980s, and that's how I took care of my first children with HIV and how I got involved in HIV research. And I can tell you back then, you felt like the young ladies in this movie because you were with an inexorable downhill course. You saw your CD4 cells dropping, and nothing the doctors could do for you before about 1987 did you any good at all. I remember my first baby with HIV was about 1985. I was on service at a hospital in the Bronx, and the baby was so sick, it was about 6 months old, and had what we call esophageal candidiasis and oral candidiasis, or thrush as we call it, but it was so severe that the baby's cries were muffled. You could barely hear the baby crying. The baby could not swallow, could not feed. And none of the the antifungal drugs that we use typically to treat Candida worked at all because the baby had no immune system. Had, I think, 2 CD4 positive cells where in that age group, probably 1,500 would have been normal. So the baby had virtually no immune system and no capacity to fight off these invading. It was the sickest baby I'd ever seen in my life. So it was those sorts of experiences that drove some of us into the HIV clinical and research field, and now I do a lot of work in Africa on HIV. HSV, the famous herpes virus, all the herpes viruses, including cytomegalovirus and a number of others, are essentially permanent infections. They like to live in various nerve ganglion roots. You know about chickenpox emerging decades later as shingles. And so HSV, we don't have a cure. Again, if you're symptomatic, we can suppress it with antiviral drugs like acyclovir, just like we can suppress HIV, but we can't cure it. So I guess the viral STDs are the closest thing we've got to a modern phantom that's chasing us around, and the only thing that's conspicuously different about the reality of viral STDs is that you do not cure yourself by having sex more often. You simply pass it on more often. I think I'll leave it at that because the hour is late and we have a number of folks from Planned Parenthood and Nashville Cares, and I think we'd all love to answer any questions or speculations you might have about the film, about sexually transmitted infections, about what the director might have been thinking, or whatever's on your mind tonight.
So we're very happy to, at this point, introduce Erin Campbell, who's the Director of Public Policy at Nashville Cares, and Elizabeth Bradner, who's the Manager of Education and Training at Planned Parenthood of Middle and East Tennessee.
Good to see you.
Thank you very much.
I got another one here. Just grab mine. Oh, I guess he's got them for all of us. Okay.
We got 3 of them. So if you guys want to speak just briefly on what it is your organizations do, and then we'll open it up to Q&A.
I'll go first. Okay, so Planned Parenthood, as far as our health center, which is what we're best known for, we have STD testing and treatment for all of them. We often refer out to Nashville Cares for HIV, but we also do pregnancy tests, and both our HIV and pregnancy tests are free, and we have pregnancy options counseling and cancer screenings. So sometimes STDs can lead to cancer, and we can screen for those as well.
And Nashville Cares is actually the largest AIDS service organization in Tennessee. We serve the 17 counties that surround Davidson, including Davidson. And part of that provide case management services. So folks who are living with HIV come and have access to different services. Also, we run the state's insurance assistance program, which is through the Ryan White program. A lot of folks know who Ryan White was from the 80s. That is to provide insurance and health coverage to people who are living with HIV. I actually do public policy and run a statewide network of people living with HIV or affected by HIV, specifically around advocacy and public policy. And so we're working on some of these kinds of criminalization laws, exposure laws as well.
Well, it's pretty straightforward, STD transmission. If you have sex with somebody with gonorrhea, you have perhaps a 1 in 3 chance of getting infected. With HIV, it's highly variable. If someone has been extremely recently infected and they have a very high viral load and it's before their immune system has kicked in to actually reduce the viral load through the human immune response, that recently infected, we call it acutely infected individual, is highly infectious, almost a super transmitter. But then after 6 months, 3 months, 4 months, 6 months, that range, that person's viral load goes down to what we call a set point. And different people have different set points. And there are many things that affect that set point. I'm not aware of anything to suggest that a libidinous individual, somebody with more or less sexual pleasure, has more or less risk of acquiring HIV or more or less risk of acquiring gonorrhea. I would think the biology would go against that. I think it's more like the bacteria contacts the susceptible tissue, the HIV, the virus contacts the CD4 positive T cell or T lymphocyte. I think it's more biological, and I'm not sure how one would necessarily translate that. There has been speculation around pregnancy, however, which is that a woman's orgasm might actually facilitate sperm reaching the womb, where it might encounter the egg. So that would be a little more plausible than, say, the STD hypothesis.
We know that they are becoming drug resistant. Specifically, gonorrhea right now is really close to being drug resistant. And if someone is HIV positive and takes a pre-exposure prophylaxis, which is a drug that they would also use if you were HIV positive, you can make your HIV drug resistant. So that can be something to think about.
Well, just to reinforce that, drug resistance is a phenomenon of the field of microbiology in general. And we are struggling to keep up with the bacteria with drug development, developing new classes. And as you mentioned, the gonorrhea is especially susceptible. In the 1950s, the US Navy tried an experiment where they gave penicillin to sailors who were going on shore leave. It was the pre-exposure prophylaxis equivalent back in the era of gonorrhea being the most conspicuous risk for sailors. So they gave them these antibiotics. The sailors took them in very sporadic ways. They didn't necessarily take them as they were instructed to take them, took them, forgot to take them, forgot about taking them at all. And they found that the incidence rates among the sailors who took the preventive or prophylactic penicillin was not much different from the sailors who didn't take it, except that when they got gonorrhea, it was much more likely to be a resistant form. So it turned out to be a really terrible idea to do that. Well, I was at the International AIDS meeting in Melbourne, the one that Joep Lange and his partner Jacqueline Terburgen and a couple of their research assistants were traveling to on that Malaysian flight. And it was a very somber meeting because Joep Lange was one of the celebrities in our field. He had been a major leader in AIDS research. He had been a major advocate for antiretroviral therapy for persons in resource-limited settings. He'd also had some experience in the policy arena as the president of the International AIDS Society. So when he died such a senseless and needless death, a consequence of essentially the Russian-backed separatists in East Ukraine in an amateurish way shooting at a 30,000-foot, high passenger plane, which couldn't possibly have been mistaken for a military aircraft, which would have flown much lower. One either wonders whether they were trying a sort of a terrorist act to get attention, or whether they were such amateurs they didn't know the difference. But one way or the other, it was a hopeless and meaningless act. It reminded us of the Swiss Air flight that went down in the 1990s and killed Jonathan Mann, who was the founding director of the Global Program on AIDS at WHO and quite a heroic spokesperson for human rights and democratization of access to prevention and care and therapy. It also killed his wife, Mary Lou Clemens Mann, who was a very good friend of mine, and they were both en route on a routine Swiss Air flight, and that was simply a mechanical failure of the plane. So we've every once in a while had these heroes of our discipline lost in very random and senseless ways. But it was a very somber mood in Melbourne, I can tell you, and even at the recent AIDS meeting at, we call it CROI, the Conference for Retroviruses and Opportunistic Infections in Seattle just, 3 weeks ago, Scott Hammer, who is head of infectious diseases at Columbia University and a major HIV leader, gave a full tribute to the Dutch AIDS scientists headed by Joep Lange at that meeting. So it's still with us as a very recent event, very tragic event. Well, let's start out by making sure everybody in the audience knows what we're talking about. So pre-exposure prophylaxis. Let's say I am a high-risk individual, and I have a lot of random sex, and I don't like condoms, and so I am at risk of acquiring HIV. If I take antiretroviral medicines, you mentioned Truvada, which is two antiretroviral medicines in a combo form, might I take the medicine and prevent getting HIV? So don't confuse that with post-exposure prophylaxis, which is now I'm a healthcare worker. I've stuck myself with a needle from an AIDS patient. Pretty sure I've inoculated myself because just a minuscule volume from a needle stick might give me HIV. And so I'm now on post-exposure prophylaxis, where will give me triple therapy for about 6 weeks to make sure I don't get HIV. And then the third option is I have HIV and I'm on triple therapy to suppress it. So we can use it for people who don't have HIV before they engage in high-risk behavior. That's PrEP, as you mentioned. Then we can use it for people with HIV to suppress their viral load so they don't progress with HIV, and also so they're less infectious to others. Or we can use it for people who we know for a fact have been exposed to HIV, a rape victim, a needle stick of a hospital worker, and to try to prevent them. So three different ways we use antiretroviral therapy: PrEP, ART, antiretroviral therapy, or PEP, post-exposure prophylaxis. So when you hear this shorthand, PrEP, ART, PEP, now you've got a sense of what we're talking about. There is a lot of controversy in the PrEP field. It has worked better with men who have sex with men. Some consistency in the studies. Started with the IPREX study, then the IPREX-Olay study. More recently, there have been 2 large studies, the IPREGAY study in France and Quebec, and then the PROUD study, which is a really big study in Britain. And on balance, men who have sex with men who are taking the PrEP have had lower HIV incidence rates. Incidence is the number of new infections over the population at risk. And they've had lower incidence rates. There is a direct correlation in every one of these studies with adherence and degree of protection. So if you take the medicine religiously, that's where you get those estimates of 98%, 96, 90% efficacy. So 90% less likely to get HIV than people who didn't. But then if you take it half the time, now it only works like 30%. And then if you take it 10% of the time, it doesn't work at all. So adherence is a big issue vis-a-vis PrEP. And a lot of men who are having sex with men are young, are immature, don't remember the bad old days of people dying of HIV, and are very spotty. I can tell you I take antihypertensive medicines every morning, and I'm really good at it when I'm in my routine. But then I go on a trip, I take them along, forget this and that. You know, the consequences for me are I have a little hypertension that day, no big deal. The consequences for somebody on PrEP, if they forget for a few days, now they're at risk again. And so it is a big challenge, huge challenge, to roll out these programs and motivate communities and individuals to take an interest in this. With the situation of women, it's even worse, and I'll just tell you that the studies are all over the map. Some of them have shown some efficacy, particularly in couple studies where there's been like a man and woman to remind each other to take them. But the studies in younger single women have not worked well, and it's because of non-adherence.
All right, I think that's all the time we have, but thank you guys for coming up here. I know our Planned Parenthood and Nashville Cares people are going to be in the lobby. If you guys have any questions for them, please feel free to talk to them out there. We have a really tight turnaround with the next film, so if you wouldn't mind picking up your trash as you head out, and please come out to our other Science on Screen events, and thanks a lot. Enjoy.